Hello, I know it's been a while. I'm back, at least momentarily, and before some of you come and chew me out, I am still wearing oxygen full time. I am just giving my nose a temporary break because for those of you who don't know, wearing oxygen, at least at higher liters, can really dry out your nose and give you really bad nosebleeds, which is really cute. So I thought while I make this video, I could treat myself to a moment off of the oxygen because I won't be exerting myself much. Kind of go from there. So main thing I wanted to cover in this video was, I guess, my recent decision to do hospice, why I made that decision, and what hospice kind of looks like for me currently. I'll start out with why I made that decision. And it comes down to things that are pretty simple. So both palliative care and hospice are comfort-based cares. So they are made to really prioritize the patient's comfort and quality of life over, I guess, the treatment of the disease. However, there is a difference in palliative care. You can still treat the disease, when in hospice, you, for the most part, cannot treat your illness. So in hospice, you are fully, I guess, succumbing to the disease. For example, a cancer patient could be in palliative care and still receive chemo. However, if they were in hospice, they would have to stop their chemo, if that makes sense. Obviously, that's going to look a little different for me because I have cystic fibrosis. But same idea. I can not really treat the illness. We are treating symptoms, and we are targeting comfort and quality. So for me, that looks like, 1, no more hospitalizations. I can possibly go inpatient at the inpatient center for hospice. However, that won't be a hospital setting, and it also won't involve all the, excuse my language, assholes I was dealing with before. So this, as hard of a decision, as heavy as a decision as it was, also brought me immense relief knowing that I will not have to deal with these people again, unless I so choose to come off of hospice, which is always an option. It's not like you're tied down to these things. If you get scared and you want to get treated, you can want to go to the hospital, nobody's going to stop you. It's just that you're no longer on hospice. Now, to qualify for hospice, I did have to receive a prognosis of 6 months or under from their doctor, which I received, and then could officially qualify and fulfill the rest of my needs for getting into hospice. That first week was just pretty busy in terms of having different people come out, introduce themselves, talk to me, so with hospice, I'm gonna have about one nurse who comes out about once a week to check in on, medications, how I'm doing, what I need supply-wise, because I am using portable oxygen now, and those tiny little tanks, they only run for about 45 minutes, so, it's definitely a planning feat when I'm going places now. I no longer can drive at the moment, or probably ever at this point, because one, my oxygen levels are dangerous, and two, the amount of morphine I'm currently taking for comfort measures to help with the short of breath feeling. It has me, I think I'm taking like 4 milligrams an hour, which isn't horribly high, but it's high enough that I'm pretty drowsy because my body doesn't have much of a tolerance to morphine yet, at least, so I'm not able to drive myself anywhere right now. Trying to think what else. We had a social worker come out. The social worker there also kind of provides services for, you know, something that would resemble counseling. As well, they have spiritual care, and not just religious care. It does cover different spiritualities or just whatever, you know, you're kind of comfortable with. There is apparently massage therapy, which is something I am personally really pumped about. I don't know, like you gotta get excited about what you can. So massage therapy sounds pretty freaking good to me. Yeah, that's really, like, in a nutshell, where we're at in terms of like how medications and stuff are going. I'm actually really surprised because I've had morphine a number of times, but it's all been a very high dose and it's all been through IV for extreme pain. And every time I've had it, it has not been helpful. In fact, sometimes it's made me nauseous or just kind of done the opposite. So I was a little nervous going into that. But I've actually found the oral morphine, now that we upped the dose properly, to be very helpful in between treatments. And, you know, when I'm not using oxygen, you know, taking like showers, that type of thing, to be extremely helpful. And it's funny because like even the doctors don't necessarily understand why it helps with breathlessness, but it definitely does. So I don't know, it's just like wild to me that I'm like, wow, there's something that could actually like aid in this sensation, and I had no idea this entire time. All my nurses, everyone who's come out here has actually been really, really wonderful. And that's something I really wanted to stress in this video as well. Like, by no hand was this an easy decision. Those of you who are close to me know that I was still through sob, you know, nearly every night. It's something I never thought would be this real, having those initial conversations in front of my mother, hard conversations, you know, do you want taken off a ventilator? Do you want to be resuscitated? Would you be interested in palliative sedation? You know, these aren't easy conversations to have alone, yet, like, let alone in front of someone who birthed you, who deeply, deeply cares about you, and then to have to kind of deliver this news that, you know, my friends who at least were knowledgeable about the situation knew, like, you know, this essentially gives you under 6 months, and that's a lucky stretch. Now, there are things they're talking about, but I don't really want to mention them until I get, like, the, go ahead on it, because I don't want to give anybody false hope, including myself. So based off of just normal hospice care, I mean, we're looking at probably not lasting through the end of the year if we look at how often I get infections, how severe those get. Also, given that it is like respiratory season, and I don't know, things are not really in my favor at the moment. So again, by no way was this an easy decision. However, I want to make it crystal clear that I feel 100% confident that I made the right decision. And I say that for lots of reasons, but even the shortest time that I've been on hospice has been one of the most stress-free relief, like, just, I don't even know how to put words to something when, you know, like, I literally, you know, I was laying in bed with my best friend, and I was like, this is weird, because this is usually about the time where, like, my intrusive thoughts start coming in, and they're like, when are you going to get sick? When are you going to be in the hospital? When are you going to, you know, and it's like, my head starts, like, trying to prep myself for that. And it was weird, because it was like, I can turn that off now. And it was like, I could tell my head, I could tell myself, no, like, you're allowed to rest. You're allowed to rest now. And like I had said before, giving myself permission to be unapologetically selfish, which is not something I do, and it's not something I'm comfortable doing whatsoever. It still has been very uncomfortable to do, has been the absolutely most kindest thing I've ever done for myself. And I'm, regardless of what people want to think about this decision, or if people want to view it as giving up, or, you know, giving in to, people like to use those, like, metaphors of fights or battles, and it's like, no, it's like, disease is just something you're given. It's not this, like, epic sport, you know? Like, it's not really, I don't really identify with that. And so people can view that how they want, but at the end of the day, like, this is my life. And something a hospice nurse told me was, after I had kind of explained my reasoning and my goals, and she just looked at me and she said, you know, this is why I do my job. It's to give these sick people who have had all control, all good things taken away from them, to give them back that power. And to see a sick person stand there and say, I want this, I don't want this, I'm not comfortable with that, I really love this, you know, that's powerful. And she told me how brave I was for making this decision, and it's just not a word, or not, you know, a conversation I thought would happen out of making this decision. But it was a really beautiful one, and I think that needs to be shared, and I think it needs to be talked about, because, you know, I won't go on here because this could take for hours, but I'm sitting here and I'm like, why do we wait till end of life to empower our patients? to trust our patients, to let them take control of their care, to let them say, this is what I need for my body, because most of the time it's right. Like, why are we waiting until people are on their deathbed to be empathetic, to be compassionate, to be trained differently on how to treat a patient just because they're dying? Doesn't make sense. We should be treating all patients the same. It doesn't, it's just mind-boggling, the difference, the absolute difference. It's been very eye-opening, very pleasantly on my behalf, because I'm like, this is beautiful. Like, I just told you what was going on and you wrote me a medication and we didn't have to fight over it. Or you didn't accuse me of being an addict when I told you my anxiety was worse and I might need an upped medication. You didn't question this. You insisted I take more of this just in case. Literally looking out for just my own comfort and security, without these, often really irrational fears of effects or, like addiction and all of that, which I'm not saying, like, obviously opioid addiction is very real, and, so is benzo addiction, all of those things. I've experienced benzo addiction. Like, that's not, I get it. But there also comes a point where if it is monitored and if we are being safe and it's distributed in an environment that is conducive to my well-being, it should not have to be something I have to fight for, if that makes sense. I guess that's kind of where I want to leave things for now. Honestly, I am pretty tired. But as for the decision, what it really, because I don't really know if I actually came down to that or if I just went on a tangent, but in the end, what it really came down to, if we do a little conclusion here, is I was going to have to be around the same toxic environment, the same toxic people, and everything that was making me really, really unwell, if I were still in palliative care. And I also didn't think I was going to get the proper comfort care that I needed on palliative care. And I think I gave myself a fair chance, met with 2 palliative teams, met with hospice. This wasn't like I just made a decision. I thought this over. Talked to my loved ones, talked to my family. But ultimately, what it came down to was, like I said, being kind to myself and putting my needs, I guess, above what others would prefer me to do for time's sake, if that makes sense. I know everyone around me would rather me in palliative care because I would likely live longer. However, 6 months in hospice versus a year in palliative care, with 6 months of those being spent arguing and, drugged up, having reactions left and right, experiencing malpractice, gaslighting, all of that in the hospital, to me is no different. I'm essentially only getting 6 months either way. And if this 6 months is going to be much better quality and much better, in terms of what I want and gives me the time and space to see the people I love, do the things I want, do them in a way that is comfortable and safe for me, then to me, that is the best way to go. And again, I understand not everybody's gonna agree, but that's not my problem. And I'm not, in a space now or ever to really care about that. This is my life, and nobody else really has the space to decide where and what I should be doing with this body. So, yeah. Thank you for listening. Really quick, I am just going to plug the fundraiser one more time because Hospice has brought up a few things, such as medications, and Hospice covers most of medications. However, they don't cover all of them. But because Hospice covers most of them, insurance won't cover, the remainder. So when going through my med list, we discovered about 3 or 4 pretty vital medications that I've been relying on for years. We're talking like 6-7 years now for some of them. And I don't know if we're going to just have to stop them completely, which is a very realistic chance there, because these medications are thousands and thousands of dollars. Some are inhaled, some are injectable. It's not just a pill, it's not a vitamin that I can easily, pay out of pocket. And so, when I'm asking for these expenses, it's the stuff like this that's gonna pop up. It's, funding these oxygen tanks that go in and out really quickly, and that allow me to, actually live my life and do really fun things, like go to Nick Cave concerts and, spend time with the people I love outside of the house. So I would just really appreciate if anyone does have the means, if they could give the fundraiser another look, even if it's a $5, $10, literally anything helps. I know it's annoying. I know it's annoying to keep hearing the same thing over and over, but truly, it's gonna keep me going, and I appreciate everyone who continues to support me, to listen, to see me, and to, support the fundraiser as it's kind of morphed and changed where this funding is going to, and now we finally have this place. So, at least now we can say, okay, it is going toward hospice. And any funding that will become, relevant after that. So I just, again, wanted to remind you guys, if you can't donate, sharing, specifically, I think sharing, with even if it's just a little blurb, if you know me or if you don't know me, I think the little personal touch, or if you do know me, then say that, because I think it's if you see a friend fundraising for another friend, but you don't know that person, and you don't even know that they're friends, and you think it's just a complete stranger, you're less likely to donate for them. So I think kind of creating those connections really help. and I'm sorry, I literally hate doing this, but yes, just sharing, donating, telling people, word of mouth, always a thing too, texting people the link, asking people directly, I've found to be definitely effective. If you know somebody specifically who maybe has a connection or knew somebody with CF, or knows somebody who works in the medical field specifically, these are the kinds of people I find that are really apt to help. So all that being said, I would appreciate any help, and I hope you all have a lovely day, night. I'm trying to think what time it is. I think like Ariel's head sphere has just disappeared from all time. I don't think like it exists. But anyway, enjoy whatever time it is, wherever you are, and I send my love and will again continue to do these updates when I can and when I'm up to it. I'm glad I was able to today, and I appreciate anyone who continues to watch. And lastly, feel free to also share this video wherever you go, because I think people getting to know me a little better is also nice when you're donating or you're giving something. It's kind of the reason I wanted to do these, so people could kind of know where their money's going and try to get to know me better as a person. But all right, I'm gonna wrap that up now. I said that a long time ago, but lots of love, and I will see you next time.